Dean Casper, would you like to get us started?
Thank you. Good evening. Chris Casper. I'm the Dean of the College of Nursing, University of New Mexico. I'm also a professor and the Virginia P. Crenshaw Endowed Chair in Nursing. Dean Kelly.
You need to unmute, Dr. Kelly.
Sorry, I'm Pat Kelly. I'm the Associate Dean for Research and Scholarship and the Higgins Endowed Professor. And welcome, everyone.
And I'm Judy Liesfeld. I'm the Associate Dean for Education and Innovation. Welcome.
Hello, everybody. Welcome. I am Carolyn Montoya, and I'm the Associate Dean for Clinical Affairs, and very happy that everyone is here this evening. And we have some exciting things to talk about tonight.
Hello, my name is Lisa Marie Turk. I am a PhD student at the University of New Mexico College of Nursing. And this evening, I am pleased to be moderating this session. As session moderator, I will support keeping us on schedule. And as needed, I will notify speakers of time remaining during their respective segments. Thank you again for joining us.
Well, again, excuse me, I'd like to welcome everybody here this evening. We all thought it was very important after such a challenging year, not only here at the College of Nursing, University of New Mexico, and the world, that it would be great to get together as a group and review some of the successes and very exciting things we've done this year. We couldn't have done it without the entire team effort of all of our faculty, our staff, our students, our community support, our clinical partners, all just helped out and pitched in the face of some of the most challenging things I think this College of Nursing has ever been through. For some of the good news, recently the new US News and World Report rankings have come out. And this is the first set of the year. There'll be some more in a bit. But the first group that came out was our increase in the rankings by 16 ranks for the best online master's programs in nursing. We're now up to 83rd in the nation, which means it's #1 in New Mexico and #8 in the Mountain West Division. We are also remain #11 nationwide for nurse midwifery. And again, we'll have further results that we'll get out as soon as they arrive. So some of the new things that have been happening in the college, one of the biggest I would bet is the choice by all to become not only the college, but divide into 2 departments. And to do this, after approval by the faculty, we have submitted this very large document called the A88, which is now moving its way through approval processes for our EVP, Dr. Doug Zadonis here at the HSC, and then it moves up to the Faculty Senate, the President of the University, and then the Regents for final approval. So we're hoping that that happens by the end of this spring. The 2 departments we hope reflect our mission and what's happening with nursing in the state. The first department will be named Rural Health and Health Equity, and the second will be Biobehavioral Health and Data Science. So as the faculty move into their 2 groups, it's going to be a very, very exciting time for the college. We have a number of new faculty that have joined us this year. For most of them, they'll be introduced by the various associate deans. But the one I would like to point out is new for us is our new associate dean of research, who you just met, Dr. Patricia Watts Kelly. Pat is both a family nurse practitioner, a nurse practitioner in gerontology. She is a fellow of the American Academy of Nurse Practitioners, as well as a fellow of American Academy of Nursing. And she's also a retired captain for the United States Navy. We are very, very proud to have another veteran joining the college. So on to the new building. We have gone through a very lengthy process to choose both the architect and the contractors. The contractors for the new building are being finalized, but has been chosen. The new architect is Albuquerque's own Decker, Parrish, and Sabatini. And this is the firm that designed the University of New Mexico, University of Michigan's School of Nursing, which you can just see on their websites right on the front. The estimated groundbreaking for the new building is spring 2022, and its estimated completion time is fall 2023. The size of the building is about 85,000 square feet and will be located in the lower part of the M lot. I guess that's the western part. And it's going to be a state-of-the-art building for nursing, nursing academics, scholarship, research, and we're very much looking forward to it. We have just begun its early stages of capital campaign for the support of the building. And we have been very, very fortunate to have received the very first gift at the $25,000 naming level from Ms. Carolyn Martinez. And we are just so grateful that she has given the lead gift. You will hear much more about the opportunities for naming and contribute to the new building in the next few months. So we would also like to acknowledge the corporate support of the student emergency funds from Blue Cross Blue Shield of New Mexico, Usenda Credit Union, and Western Sky Community Care. So on that, I would like to turn it over to Dr. Pat Kelly.
Hi, good evening, everyone, distinguished guests, alumni, colleagues, and students. I'm very honored to be presenting a little bit about scholarship and research at the College of Nursing. I joined the College of Nursing in July, and I'm the new kid on the block, and I'm very excited to be here at the university with my distinguished colleagues and very motivated student body. My plan is to build upon what is here, expand and widen our outreach within the College of Nursing to improve healthcare in the Albuquerque community at the state level, the national level, and hopefully have our distinguished faculty and students impact healthcare around the world. Our research and scholarship is reflective of the needs of the community and the health needs at the local and national and international level. I envision hopefully a center within the College of Nursing with several foci areas that will foster cross collaboration and fall nicely within our two departments. I would like to tell you a little bit about our current research within the College of Nursing. We have women's health initiatives that address women living with substance abuse disorders, mother-baby interaction, human milk, micronutrients, and analysis of human breast milk that may look at a genetic molecular level to determine possible carcinogenic factors from the environment. We have a program of research and scholarship that looks at adolescent high-risk youths. We also have another area of research looking at adolescent school nurses and healthcare delivery in the pandemic era of COVID. We have another grant that we're looking at, and hopefully will be funded, but we'll do it anyway, I think. Looking at complex chronic conditions and behavior change and patient monitoring through self-care and self-care management and telehealth, especially in the COVID era. We have applications and projects that are going through the Robert Wood Johnson Foundation, looking at rural health and using over-the-counter medical monitoring devices to deliver care to people in rural areas within New Mexico, and to see if it would be a cost savings measure to help do more robust telehealth in the community. We have mentoring and student development applications that have been submitted, such to the Macy's Foundation for faculty development. We have an application with the Utah where a faculty member can go and work in this research study to write an R01, and will is part of an initiative to grow a body of scientists. And one of our faculty members, actually our associate dean, Carol Montoya, just put in a grant that we hope we get to build workforce diversity in the College of Nursing. We have heavy metals and environmental scientists who were researchers here. We have people living with complex chronic conditions, scientists who's interested in that. We have a couple of scientists, nurse scientists, who are very interested in disaster and pandemic responses. And we have a subset of individuals who look at military and veteran health issues. To date, we've put in approximately 23 grants since July, and we have a few more in. We haven't heard whether we'll receive any of them. If we're fortunate to get all of them, it'll be 3.8 million, but I don't think that that will happen right on the first time. We have several scholarship series for the Alumni Association and for all faculty and community members. The first presentation will be on February 24th, 5 to 7, and it will be social justice in nursing and public health preparedness. We will have another one in April, which will focus on women's health, and another one in the middle of the summer that will talk about military and veterans, and we'll have an additional one in the fall to be announced. We have a couple of guest speakers coming to help build our scholarship and programs. Dr. Eileen Collins, who's the Associate Dean of Research and a professor at the University of Illinois at Chicago, will come and talk about how to develop a program of scholarship and research. And we have in the spring, we have Dr. Judith Vesey, professor at Boston College, will offer a workshop on how to put your program of scholarship and research into action. I'd like to announce our newest faculty members. We have Professor Dr. Roberta Lavin, who is a family nurse practitioner, a fellow in the American Academy of Nursing, and her research interests are in pandemic health and emergency preparedness, to name one of her areas of interest. We have Dr. John Yu, who has joined us. He's a physician and PhD prepared professor whose research interests are in the area of public health, environmental toxicity, and health data sciences, which fits with several of our research areas at the university. We have Dr. I call her Katie, her full name is Catherine Zakowski, who is a toxicologist by education. She's our newest assistant professor who works in the environmental health area and looks at biological mechanisms of inhaled toxic exposures. So we have a robust faculty. We have a lot of ideas in the pot working and cogitating. And I thank the staff and the faculty for their hard work and endeavors to improve the science and scholarship at the College of Nursing. Thank you.
Dean
I
Lee,
hand over to Judy Lesfield, Dr. Judy.
Hi, welcome everybody again. I too want to thank all of the faculty, staff, students, and colleagues for their hard work and tenacity this past year as we quickly had to adjust to the pandemic crisis. We have many wonderful both undergraduate and graduate programs here at the College of Nursing, and this evening I will be highlighting 3 of these programs. So first, I'd like to start with our UNM West undergraduate nursing program in Rio Rancho. As you're aware, we admit 64 students into our pre-licensure main Health Science Center nursing program twice yearly. In fall 2018, we admitted our first cohort of 8 students at UNM West, and they graduated in spring of 2020. This year, we admitted 24 students, both spring and fall. And the nursing students there have a beautiful facility with the nursing program housed on the 2nd floor with their own skills lab. And due to our continued growth, we're adding a 2nd skills lab, and architects will soon be also developing a simulation center. Next, I want to tell you about our direct entry program, and just so that you're aware of this program. Traditionally, students are admitted into the College of Nursing the 2nd semester of their sophomore year. With the direct entry program, motivated high school seniors seeking a nursing career and who meet established criteria can apply and receive guaranteed admission into the College of Nursing. We now have our first direct entry program students taking nursing courses. 3 started in the fall 2020 and 11 started this spring 2021. The goal is to have 20 freshman direct entry students each year. These students are encouraged to participate in our College of Nursing Honors Program and to develop an interest in research and in continuing their education in our graduate programs. Finally, I want to highlight our New Mexico Nursing Education Consortium partnerships, and we fondly call it NEMNEC. NEMNEC is now 11 years old. With partnerships between the College of Nursing and community colleges, students are co-enrolled and receive their Bachelor of Science degree from the College of Nursing while taking courses exclusively on their hometown, from their hometown campus. UNM College of Nursing has partnerships with our branch campuses, Taos, Gallup, and Valencia, and partnerships with San Juan College, Santa Fe Community College, and Central New Mexico Community College. And the BSN has exponentially increased in New Mexico due to these partnerships. Many other benefits exist, including recent collaboration between program directors during the pandemic that resulted in problem solving to continue online learning and virtual simulation. All NEMNEC schools continue to thrive with excellent progression of students and excellent NCLEX pass rates for 2020. Next, I want to introduce you to some of our new faculty. First, we have Dr. Melissa Cole, who is a concentration coordinator, clinician educator, and assistant professor in the MSN administration program. We also have Dr. Lisa Day, who is a professor focusing mainly in our undergraduate program, who is just a primo nurse educator with expertise in nursing pedagogies. Dr. Katie Kivligan is an assistant professor in our nurse midwifery program. Dr. Joellen Schimmels is a clinical educator and associate professor in our psychiatric mental health nurse practitioner program. Dr. Jennifer Schneider is a psychiatric mental health nurse practitioner and clinician educator and assistant professor in our psych mental health nurse practitioner program. Also, we have Dr. Lisa M. Taylor, a clinician educator and assistant professor at the University of New Mexico College of Nursing. And in addition to these faculty, we also have our faculty lecturers who've been hired to mainly teach in our BSN program. These individuals are Sarah Dakin, Kathleen Dolan Cox, Katie Garcia, Mitch Irving, Allison Phillips, and Michael Shannon. And at this time, I'm going to turn it over to Dr. Montoya for her presentation.
Good evening, everyone. We are so happy to have you all here. As I said before, the College of Nursing depends heavily on our community partners, not to mention our alumni, and all of the generous people in the audience who give of their time, their talent, and often help us support many of our efforts through monetary donations. So we really appreciate everything that you do for us, especially in this time of COVID. I would simply mention that one of the more frequently used endowments that we have is the emergency scholarship. As you can imagine, everyone has been hit very hard, and that includes the students. We have many Native American students who have been on their reservation and have been hit particularly hard. And I'm here to tell you that it has been very satisfying that we have been able to assist them with funding from that emergency scholarship. So thank you so much for all of you who donate. So I'm going to talk about our clinical partnerships as well as some of the growth in our communities that we serve. I want you to know that we remain very committed to rural and underserved populations. That has been the College of Nursing's mission since I was a student here in the bachelor program. And so we continue that commitment with our clinical partnerships. I'm going to talk first just a little bit about the undergraduates to give you some kind of sense of that. So I'm going to look at my notes so I don't misstate them. So for the year of, for actually the fall of 2020, we had a total of for the undergraduates, we had a total of close to 600 different site placements for our students. You remember that our undergraduates are the largest group of students we have, numbering a little over 500. And we send them to places, primarily we use UNMH. UNMH is our very strongest partner. And you can imagine what it was like when COVID hit and we had to stop clinical rotations for a while. But UNM was the first that when we were deemed it safe, because that is our number one priority, is the safety of our students, our faculty, staff, and the patients that we serve. And UNM really stepped up to the plate, UNMH. So I have to give them an enormous amount of credit for what they did. But we don't just use hospital settings. We use UNMH primarily. We use Presbyterian, Lovelace, SMRC, and all of these are strong community partners at the undergraduate level. But we also send them to places like, oh, and not to mention the VA. The VA is one of our strongest partners. Bernalillo High School, we send them to the geriatric clinic. We use Heart Hospital. We use the UNM Student Health. And these are just examples of places that we send our students to in addition to the hospital settings. So that is a huge lift on the part of our faculty and our staff to ensure that our students at the undergraduate level get appropriate clinical rotations. In addition to that, they also get simulation. And as you may well be aware, simulation increased greatly once COVID-19 hit. And I want to really commend our faculty and our staff who adapted. As you may be aware, the College of Nursing has several totally online programs. So for us to move into that online world was probably not as hard as it was for some traditional programs on main campus, because we have already done so much online. In terms of the advanced practice concentrations, we have the family nurse practitioner concentration, we have adult gerontology, acute care, we have pediatric nurse practitioner, nurse midwifery, and psych mental health. So that's a lot of concentrations. So the total number of rotations that we did in 2020 were over 300, close to 400. Out of those, we, as I said, we are very committed to rural and underserved. 108 were in rural or medically underserved areas. 119, again, were with our UNMH partners. Presbyterian also assisted. And, you know, one of the things that we count on for those of you out there that are preceptors for us, I have a special thank you for you, that all that you do when you precept our students, both at the undergraduate and the graduate level. At the graduate level, we got 63 new preceptors in 2020, and that's due to the remarkable staff that we have at Clinical Affairs who do their best to get preceptors and place students in clinical. And out of all of our preceptors, we have about 75 that are alumni. So we count very heavily on those alumni. Dr. Kelly mentioned the grant that I have put in. I want all of you to know that, you know, many of you have endowments that assist students or are endowments that relate specifically to research or NEMNEC or one of our other programs. I want you to know that at the College of Nursing, we also work very hard to get workforce grants to support our students. So one of those that I have is called the Advanced Nursing Education Workforce Grant. And this is a 4-year grant out of Health Resources and Services Administration. And it allows, let me look at my notes so I get it right. It allows $15,000 that we give for second-year primary care APRN students. A total of 23 students receive that funding. So this helps them immensely in terms of their education and prevents them from graduating with a huge amount of debt. The grant that Dr. Kelly was referring to that I submitted is aimed at undergraduate students. And we will be, if we get that grant, we won't find out till late May or early June. And that would allow us to give a similar kind of funding to undergraduate students over a 4-year period. So we work very hard. Dr. Leavsfeld has several grants that she uses with undergraduates, some that are focused particularly in encouraging Native American students to become nurses and assist them. So we try to do our part as well. We've grown quite a bit in the number of communities we serve. We go completely around the state. Midwifery sometimes does some rotations that are in some particularly suitable midwifery practices that may be in another area of the country. So those are very few, but those are our clinical partners as well. One of the things that I wanted to leave you with is I want you to also understand that in this time of COVID, when the vaccine became available, I want to really commend everyone who stepped up to help. I want you to know that all the nursing students were volunteering in UNMH to vaccinate our healthcare workers who are on the front lines. Not only were the students there, faculty were there supervising students, but faculty and staff who have that ability went and volunteered as well. And I will tell you, if I had to say one thing that made the biggest impact on me, I went the very first day we had the vaccine. And I will tell you, it was so rewarding to give those people, those nurses who were putting their lives on the line, who were exhausted. There was no better feeling than to give them their first vaccines. And they came in and they had stories, and it wasn't just the nurses, the respiratory therapists, the physicians, anyone involved in patient care. And I would say that that was the highlight for me, giving that, and that we had so many people willing to volunteer, and this will continue. We will be doing vaccines for quite a while. So again, thank you for everything that you do. We greatly appreciate what you do. And the College of Nursing remains strong, it remains positive, and it is here to meet the needs of New Mexicans and across the country and internationally as well. So with that, I'm going to turn it over to Lisa Marie Turk.
Thank you very much, Deans Casper, Kelly, Leesveld, and Montoya. I hope you all enjoyed this presentation. Now the deans will answer some questions from the community. The first question is for Dean Casper. from a donor to the UNM College of Nursing who would like to know where the new building will be located.
Well, that's just been decided. We will be located in what is known as Emlot, which is south of the Dominici building. And will be immediately across the street from the UNM Physics Observatory. And so it's on that end of the lot, and the other end between Nowitzki Hall, where the dental hygiene school is, and the other end where the federal courts are. So it's a great position with access to everything on the HSC campus.
Thank you so much. Dean Liesfeld, a UNM College of Nursing alumni and donor asks, what graduate programs are offered at UNM College of Nursing? And where are CON graduates working?
All right, thanks, Lisa Marie. Dr. Montoya went through a few of these, but I am happy to review them again. Our MSN and postmaster certificates include nurse practitioner in adult gerontology, acute care nurse practitioner. We have the family nurse practitioner program, the psych mental health nurse practitioner program, pediatric nurse practitioner, midwifery, nursing administration, and nursing education. So we're very busy with those MSN programs. We also, in addition, have the DNP program, the Doctorate of Nursing Practice, with clinical concentration or nurse executive organizational leadership. We call it NEOL focus. And then we also have our PhD program. So that rounds out our graduate programs. As far as where College of Nursing graduates are employed, I think this is one of the beauties of nursing, that really nurses are everywhere. We have graduates in a huge variety of places, from clinics to hospitals to schools, colleges, universities, nonprofit organizations, prisons, birthing clinics, lots of different places. So really, anywhere a nurse could be employed, we have graduates there.
Thank you very much. Dean Montoya, this question has two parts and was asked by one of the college's preceptors. What is the College of Nursing's position on the value of the physical exam and the value of virtual healthcare? And what is the College of Nursing actively doing to continue to support the acquisition of physical assessment skills?
Thank you, Lisa. So I will tell you that having been here a very long time, I have taught physical assessment in just about every single form you can teach it. And I still remain committed to an on-the-ground course. I will tell you that the majority of, there are so many online NP programs now, and a majority of them are offering physical assessment as an online course. They tend, though, to bring the students in periodically to validate the skill sets that they have. At the College of Nursing, we have continued to run the physical assessment course as a on-the-ground, quote-unquote, on-the-ground course. And that way we can validate those skills as we're doing different systems. However, as we hit COVID in the spring time last year, we had to adapt, and we did. And so a lot of what we were teaching was online. When we were allowed to be back in the classroom with many safety precautions in this time of COVID, we brought students in, and we continue to do that. I'm smiling because I'm thinking of Dr. Christy Kogel, who runs the FNP program. And I would say she was calling me every other day to say, when can we be back in the classroom? So when it's deemed safe, we bring them back. We will continue to do that in order to ensure that their physical assessment skills are appropriate, because in truth, that is the key to everything else. That is the key, and we really believe that, and we really put a lot of emphasis on our physical assessment course, not just a didactic, but practice of the skills. And we also use something now called the objective structured clinical exams, where students are given the same scenario and then have to see the patient do the exam. And this is something then that we are either watching or we see it on tape, and then we provide feedback for them to improve those skills. So it remains very important for us.
Thank you so much. Dean Casper, another College of Nursing alumni and donor asks, how is the UNM College of Nursing competitive in attracting and hiring new faculty?
Well, I think we've been fairly competitive. We've had a great ability to recruit in the last few years, at least since I've been here. We've had a number of out-of-state faculty who have joined, and we try very hard to constantly look and reevaluate things such as our pay scales and match them to AACN standards nationally for specific for Research One universities with a health sciences center. That's helped a lot. And also we provide, unlike many other schools, support packages for the new scholars and researchers, which is a very, very important investment in people's careers. Some of I know our faculty have also done a really good job, and when they go to national meetings, shall we say, meeting as many people as possible and enticing them in. Dr. Montoya did that recently with someone she'd been courting for years. So I think we're in good stead. You never can let your guard down, however. And given the challenge we have across the country in nursing, which is the increasing average age of Research One university faculty, we have to keep our eye on this all the time and anticipate potential retirements, anticipate bringing in new and eager researchers and clinicians into the college. So it's kind of an ongoing thing, but I do think we are very attractive. Actually, outside of New Mexico, everybody thinks this is a great place, you know, the land of enchantment. So they want to go skiing to Taos. So I think we've got a good shot at it. Thank you.
Thank you. Dean Liesfeld, a UNM College of Nursing donor, asked this question: what is the change in the number of male students since 1970?
This is such a great question, I think. I'm guessing that maybe this person might have graduated from nursing school in 1970. That's my guess, the person who might have asked the question. I'll just share that, I'll give my age away, but I graduated in 1976 with my BSN from a large university, and there were only 2 male students at that time. And we did some research on this question, and we're not able to go back that far to 1970, but we do know there's a 3-fold increase in male students since 2010, when there were just 49 males enrolled. Now we have 160. And the first large jump occurred in 2015, when the number nearly doubled from 2010 to reach 84. And we think this happened because of our enrollment with our UNM partner schools through NEMNEC, the New Mexico Nursing Education Consortium. And certainly recruiting male students is right up there as a priority, because we truly value diversity in nursing, and we do want to see more male students as nurses. Thanks.
Thank you so much. Dean Montoya, what is the administration's long view on the progression of integration and or acceptance of the nurse practitioner role in the healthcare landscape?
Well, we're very fortunate here in New Mexico because we have full practice authority, and we have had full practice authority for over 25 years. in the general landscape nationally, we keep going up. I think we're at 23 or 24 states now that have full scope practice. And I think Massachusetts just passed, I saw a flyer in about, I think it's Massachusetts that went full scope as well. So I would tell you that we monitor that very closely here at the College of Nursing. We have my PhD was had a component. I was a Robert Wood Johnson Fellow in Health Policy. So I'm very, very interested in health policy. And so we certainly take a great interest whenever the legislature is meeting, especially if the Nurse Practice Act is being opened and what is being done there at the local level. I have served on national committees. I'm currently with the National League of Nursing on their policy committee. So we stay abreast of that. We're very fortunate that one of our faculty members, Dr. Barb Dameron, is actually the legislative guru, is what I call her, for actually the university. She's the consultant. And so she certainly keeps us abreast of any changes. I think that, you know, we are in a good place here in New Mexico, and that's a reason that many faculty actually want to come here and move here because of our full scope practice. So I think we're in good shape, and as long as we continue to monitor and keep advocating for every healthcare professional to work at the full capacity of their education and their licensure.
Thank you so much, Dean Montoya. Dean Casper, a donor couple asks, we understand that many universities are facing very difficult times resulting from both declining enrollment and associated budget decreases. This is now exacerbated by COVID-19. And Dean Casper, this is a three-part question, so if at any time you need me to repeat the questions, please let me know. The first part is, do you anticipate any staffing reductions attributable to this? Do you anticipate having to curtail programs because of this? And if so, what might those be? And third, would any auxiliary campuses where there is a nursing program be targeted for closing or severe cutbacks? And if so, are those known at this time?
That's a very appropriate question for these times. And I'm very much aware, reading the Chronicle of Higher Ed, that many, many schools are in very severe straits. Fortunately, to most of these questions, the answer is no. We are in very good financial health. And if anything, we are going to be increasing the number of students and increasing programs. I think the combination of very good stewardship of the funds by the members of the college, and I have to, give a lot of credit to our chief of staff and chief financial officer, Jose Gonzalez, and his staff for providing just superb financial guidance and stewardship. It's very much appreciated. No, we're not going to have any losses of staff. We have been hiring a number of them lately to meet the ever-growing needs. And I think we still have a few more full-time staff positions to fill, along with a few more faculty positions. So the answer is no, we won't have to curtail any programs. The state legislature and our regions are very, very much invested in the health and well-being of the college, and are continuing to encourage us to increase enrollment at the NIMNEC partner schools, to support the UNM branch campuses and our programs there. So I think we're very, very fortunate on so many levels with this. Our mentioned auxiliary campuses, I would say that those are the UNM branch campuses. They are also doing well. As far as Dr. Leesfeld has reported, so are the NIMNEX schools. So nursing is in very high demand in the state. The last report from the Workload Commission said that we were short 6,000 nurses in the state. So if anything, nursing is a very popular major, and I think will continue to be well supported here in New Mexico.
Thank you, Dean Casper. Dean Leesfeld, how many students are there in each degree program at the College of Nursing currently?
All right, I want you to all know that I know this off the top of my head. No, just kidding. We did research on this one as well. We have a lot of students. In our BSN program, we have 805. The MSN Master's Program, we have 117. People pursuing postmaster certificates are 13. We have 36 in our Doctorate of Nursing Practice, DNP program, and we have 23 in our PhD program for a total of 994 students. That's a lot of students. Thanks.
Dr. Leesfeld, thank you for having those numbers so readily available in your head. It's very impressive. Dean Montoya, one of our community partners would like to know how COVID-19 has affected clinical placements.
Thank you, Lisa. And I spoke to that a little bit. It is a challenge. In fact, I was talking with the FNP coordinator just before I got on this call because things change so rapidly. We don't know who is doing in-person visits versus who those that are using telehealth. So part of what we have done is that we are doing telehealth visits. Our students are involved in doing telehealth visits as well. So it's really a mixture of trying to blend some in-person experience with these telehealth visits as well. Because again, as when I was talking about the physical assessment course, telehealth is a great tool, but there are many reasons that you need to see a patient in person. So it is a challenge. And so I would say to all of you out there that if you are a provider and you have the ability to precept a student, we are really in desperate need. And Judy, Dr. Leesfeld just talked about the growth that we have had in the college. We, and Dean Casper alluded to this as well, we are not scaling back. In fact, if anything, we are going up. These are just going to get more and more. And it is going to be a challenge to get sufficient number of hours in person clinical. Simulation works. The objective structured clinical exams are very helpful, but at the end of the day, people need the hands-on and they need some portion of that, the hands-on. So we remain committed to that. And again, I have to commend the staff that I work with who do, I think, a miracle every single term in terms of placing all, just imagine placing all undergraduate students. Judy said 900 plus, 900 plus. And on some terms, it's 1,000 students. It's a lot of students to place.
Thank you very much. Dean Casper, another donor to the college would like to know, who do you report to and what is the administrative structure at the Health Sciences Center?
Well, actually, very good question. Recently, the reporting structures did change a bit by President Stokes, who, upon the retirement of Dr. Roth, who had been the chancellor of the Health Sciences Center, as well as the School of Medicine dean, we just, December 1, Dr. Douglas Zadonis started, and he's now the executive vice president of the Health Sciences Center. And he has the purview over essentially everything that goes on here, all the academic, the 4 academic colleges, as well other academic programs, the hospital, the medical practice, and a few other things that are under that overarching umbrella. So in this new role, Dr. Zadonis is no longer the dean of the School of Medicine. There are 4 colleges, College of Nursing, College of Pharmacy, College of School of Medicine, and the College of Population Health, who equally report to Dr. Zadonis in the reporting structure directly. The research missions under the, I still call the Vice Chancellor of Research, Richard Larson, also reports directly to Dr. Zadonis. So that's been a bit of a change there, but it works. Thank you.
Thank you, Dean Casper, for shedding light on that administrative structure. Dean Liesfeld, one of our donors asked, how many graduates stay in New Mexico?
Okay, that is a really great question. We believe, and our records show that we have over 5,000 alumni who have stayed in New Mexico. So per cohort, a great majority of those graduates do stay in New Mexico.
That is great news. And at that, Dean Casper, I'd like to ask you to close the session for us this evening.
Well, thank you, Lisa Marie. And since it has been noted, I must thank Lisa Marie Turk, one of our most talented PhD candidates, about to graduate, for her moderating the sessions this even soon, Susan Lisa Marie. But I'd like to thank everyone for sharing this wonderful evening with us. It's always, especially in these times, very special to engage with all of our supporters and alumni and donors and everyone who touches the College of Nursing and so marvelously supports us. It's been a privilege to have you here this evening. So I look forward to your continued interest in the college and what we're up to and how we will emerge very successfully out of the current COVID crisis. So again, I'd like to thank you all, and I'd like to remind you that if you have any questions, you can use the email and the information that will be put up shortly on the screen for the Zoom meeting. Thank you so much again, and good evening and good luck.